A warm welcome and thank you for keeping it right here on Sunrise. I'll see you just in time for your wellness, beauty and lifestyle segment. My name is Shivan and I'm back again with the good doctor at Diopter Eye Care Center, none other than Dr. Abubakar. Thank you for joining us and good morning.
Good morning. Thank you for inviting me. I'm glad to be with you here today and I hope our viewers will learn from our talk today.
Absolutely. So this morning we're going to be talking about a condition that almost affects 60% of the population in Uganda, and that is actually blindness. Now it's very important that you, before we even dive into the conversation, that you understand what blindness is. Well, blindness is the inability to see anything, including light. If you are partially blind, you have limited vision. For example, you may actually have a blurry vision or inability to distinguish the shapes of objects. Complete blindness means you cannot see at all. However, there is yet another interesting term when it comes actually to blindness, and that is legal blindness. Now it refers to the vision that's highly compromised. What a person with a regular vision may see 200 feet away, a legally blind person may not even see it from 20 feet away. Now when it comes to blindness, it depends to the extent to which it has actually affected the eye, and depending on the cause of your blindness, immediate treatment may increase your chances of restoring your vision down from actually getting either antibiotics or even having a surgery on your eye. And that's the conversation that we're going to be having this morning. So doctor, let's cut right to the chase and first of all understand, what are the symptoms of someone losing their vision?
Thank you very much for that question. I hope you understand what the word symptom means.
Yes.
It's what someone feels. I don't know how you feel. If you have pain, I don't know if you're feeling pain or you're not seeing. So as you mentioned, blindness. If someone is blind, their symptom, number one is I can't see well, or I can't see completely.
Okay.
So if someone can't see well, or they can't see completely, then they're blind.
Okay.
So it's one of the symptoms. I don't think there's another symptom.
Is that the only one that you can actually be able to tell that you're slowly becoming blind?
Yeah, of course. You can describe how it comes about. It can come slowly, progressively. It can occur suddenly, and someone loses their vision suddenly. So, but the whole point is someone says, I can't see well. So,
how about in infants? Now that is for adults. How is a mother able to tell that their child is slowly losing their vision?
That's a very important question, actually. One thing you should know that it's not easy to assess vision in infants.
Yes, absolutely.
However, we should. I want our viewers to understand that when someone is born, their eyes have never seen anything in life. So development of vision starts when they are born. And visual stimulation from light, colorful objects, and seeing things is what helps the vision to develop when someone is young. So how can you tell that someone is blind if they are an infant, a baby? So we have ways of assessing that. One of them is if they can follow some bright objects. We look at the pupil reaction, that black spot in the eye,
yes,
how it constricts on light and everything. So we look at that. But importantly, when a child is about 1 month, 1 to 2 months, they can follow objects. For example, your face. If you take your face to the other side, they can follow. The other side, they can follow. It means their vision is intact.
Okay.
So if a child can't blink on the flashing of light, they can't have their pupils constricting, they can't follow objects at 1 month or so, then there could be something wrong with their vision. So they could be blind.
Okay. So what are the causes? What are some of these conditions that lead into blindness?
Yeah, that's very important. I think everyone is very much concerned. You imagine if you're blind, life would be very, disappointing. I mean, no one would love to be blind. So I think everyone is interested in knowing what could be the cause of blindness. Before it comes to you, some can be preventable, others are treatable at various stages. For example, someone is born and they have chances of getting blind. We can prevent blindness at a young age.
Okay.
We can also do that even during pregnancy.
Okay.
Okay, so there are 3 major causes of blindness worldwide. Number 1 is cataract. Cataract. They call it Nsenke.
Okay.
So cataract is the clouding of the natural lens in our eyes. Okay. I always use my model here. Very important for our viewers. This is your eye. You have a lens in your eye. that helps you in focusing distant and near objects.
Okay.
So this lens has to be clear like glass. However, if it gets cloudy, then light can't reach the back of the eye that sees. So you get blind. That's the number one cause of blindness worldwide.
Very many people have said that that particular cause is attributed to people that are much older.
That's very good. So this is now risk factor for developing cataracts. So what causes cataracts? Number one cause is aging. If someone grows older, especially 55 years, 50 and above and older, your lens starts getting opaque, starts clouding with age.
Okay.
So you get blind from a cataract, okay? Otherwise, there are also other causes. If someone has trauma to the eye,
Okay.
if someone hits your eye, or in an accident and something hits your eye, this lens can get opaque, so you get blind from a cataract.
Okay.
The other cause is diabetes. Those who are diabetic, especially those who have uncontrolled sugar levels. If you're diabetic, or you don't know if you're diabetic and sugar levels are high in your blood, chances of this lens becoming opaque are high. So you can actually get it at a younger age. We have had patients who are 18 years with type 1 diabetes and they have cataracts. The other thing is some drugs can cause cataracts. We are fond of buying eye drops without prescription, using some tablets like prednisolone without prescription. These have the potential of causing cataracts, okay? So that's the number one cause of cataracts worldwide. Then two, we have what we call glaucoma.
Okay.
Glaucoma is difficult to translate into our local languages, but there's one factor that helps that causes progression of and glaucoma. That is intraocular pressure, eye pressure.
Okay.
The eye pressure is different from the systemic pressure. Yeah, it's different. Our eyes have some fluids that are produced and drained. Okay, so if there is a reduction in drainage of that fluid, pressure builds up in the eye and it can damage some nerves that help us in seeing. So glaucoma is the second leading cause of blindness worldwide. It's one of the very tricky diseases of the eye because it causes blindness without you knowing. So glaucoma is number two. Currently or recently we are having a high rise in diabetes in our population because of lifestyle and diet, okay? So we have what we call diabetic retinopathy, a disease that affects those who are diabetic with uncontrolled sugar levels. So diabetes damages many parts, so in many organs in our bodies, including the kidneys, okay, kidneys and many other parts, but also the eyes. Diabetes damages organs that have very small blood vessels. So our eye is here. Okay, this is our eye. We have what you call the retina that helps us in seeing. It has one of these small blood vessels. Okay, so what diabetes does, it damages them, and you can develop what you call diabetic retinopathy. It's a blinding disease, and it's on the rise now because people are not aware of their sugar levels. So that's number three.
Okay.
Very important. Okay. There are many other causes of blindness. For example, if you have trauma, your eye can go.
Yes.
I mean, you can go, you lose your eye, and you get blind.
Okay.
Those who work in very, construction sites where there are stray objects, so it can hit your eye and get blind. Importantly, who is considered blind? It's us supposed to make that diagnosis of who is blind. Okay. Blindness is if someone's vision is. We use our charts. Last time I told you about our charts that we use in measuring vision. If someone has visual acuity of less than 360 in the better eye, if one eye is seeing well and the other one is having some degree of visual impairment, you are not blind because one eye is seeing well.
Okay.
So we define blindness if the best eye that sees is having that very poor vision. Okay. So we should be very careful about these blinding conditions because we can prevent blindness from those conditions. Diabetes, you can try to do a checkup and find out if you're diabetic and have treatment. For cataracts, we don't have control of aging. Okay.
Yes.
However, cataracts, there's one good news about cataracts. It's treatable. You can treat it, and someone sees again.
Okay.
Yeah.
Finally, let's look at the damaging of the retina. In a way, does this actually lead to blindness of the eye?
So how does damage of the retina? Our retina is what helps us to see. Our retina is that back of the eye where light reaches and then image is formed and taken to the brain so that you can see. So our retinas have nerves that take information from the brain, but two, they also have blood vessels, okay, that supply the retina and also take away waste materials back to circulation. So what diabetes does, okay, it damages those blood vessels, so they get delicate and they can easily rupture.
Okay.
They can leak some fats and deposits in the retina, and this can affect the functioning of that retina. Okay. It has degrees, it has stages, and depending on severity, you can get blind if your retina gets badly damaged with, especially diabetes mellitus. So that's how diabetes damages the retina. The blood vessels mostly get damaged, so they can leak fats, proteins, and that leakage, of course, affects, if it leaks on the retina, then it cannot function normally.
Okay.
Yeah, you can have a bleed, and the entire back of the eye is full of blood because of leaky blood vessels.
Okay. Well, thank you so much for being a part of this conversation, and I hope that the viewer watching was able to pick a thing or two.
Welcome.
Well, that winds up the conversation that we had for you this morning on wellness, beauty, and lifestyle. I hope that if you were listening, you are able, and now that you can tell if you are slowly slipping into blindness. But again, it's very important that you see an optician to be able to diagnose that kind of condition. Otherwise, we still have an amazing lineup for you this beautiful morning. So keep watching Sunrise at Sea. My name is Shivan.